The private sector is a potent partner in this regard, and we continue to work with them to utilize their structures, especially when it comes to social media, and to share data-driven messaging and behavioral change information to the grassroots. The task force is also partnering with the Federation of Muslim Women's Association and the Christian Associations of Nigerian Women to support our aggressive approach towards behavior change at the grassroots. I would also like to mention the critical partnership with other major radio stations, including Voice of Nigeria, Radio Nigeria, Wazobia, Ray Power, and a lot of others, too numerous to mention, in order to develop COVID-related programming that features COVID survivors, religious and traditional leaders, frontline healthcare workers, and other members of the public, so that we can foster a dialogue around COVID-19 and address some of the misinformation as regards whether or not COVID exists and whether or not it is really a health issue. It is only by working collectively and together that we can beat this disease. Finally, as mentioned by the chairman, next week we will be addressing the issue of Salah. We will be liaising with our religious leaders and build on the guidance we have already provided for places of worship to come up with a clear advisory on how Nigerians should best conduct themselves during this festive occasion so that they remain safe and we all remain safe. We will also be providing a summary of achievements by our key partners, including CACOVID, in line with our transparency principles. Thank you.
Thank you very much, National Coordinator. We'll move to the question session now. If you're ready, we're ready for your questions.
Mr. Chairman, members of the task force, my colleagues, good afternoon. My name is Nancy Oyedia Orom from AIT. I would like to start with you, Mr. Chairman, since the Foreign Affairs Minister is not here. So just yesterday, we got a report from the United Arab Emirates giving Nigerians whose visas have expired up till the 17th of August to leave their country or face legal consequences. So I would like to find out what are the implications of this for Nigerians who are yet to be evacuated from that country, and those who do not have resources to pay for their air ticket to be airlifted back to Nigeria. Now, to the Minister of Health, so I'm sorry I have to bring up this issue again of hospitals rejecting patients. Just yesterday, DAC Communications PLC lost a senior consultant as a result of this rejection by hospitals. Yes, he tested for positive. He was still awaiting his result, and because of the symptoms was degenerating, so he was taken to about 3 hospitals here in Abuja, and he was rejected. Eventually, when he could access medical facilities, he gave up and died, I think, just yesterday. So it brings me to my question. Have there been any hospital that have been brought to book as a result of this rejection that have become a regular phenomenon? And to the Minister of Education, sir, some parents have contacted me saying that private schools have reached out to them to pay for third-term school fees, even as schools are yet to resume. So I don't know if the ministry is aware of this. And also still staying with you, sir. WAEC is a West African examination that about 5 schools are supposed to be participating, but Nigeria seems to be the only country that have taken a U-turn from participating in this exam. So I want to know, have you taken out time to do like a peer review or analysis of what some of these countries are doing that Nigeria could actually do also, just to accommodate some of the peculiarities that is a major bone of contention for us? And also, I want to believe that since the decision was taken for Nigeria not to participate, you have been engaging with WAEC, maybe for a possible reschedule for just Nigeria alone as a country. Finally, sir, in the guidelines that you reeled out for safe resumption of schools, you said that schools should assess themselves and then send a report to the Ministry of Education. I'm a bit worried how authentic that report will be, making them the judge of themselves. I don't know if your ministry have come up with mechanism to check the preparedness of the schools for possible resumption. Thank you.
Good evening, sirs. My name is Friday Okerigbe. I'm a reporter with Channels TV. I think I will just start on the note of that schools resumptions, and I will direct that question to the Minister of State for Education. There's been so much mixed information online as to when schools will be resuming. I'd like you to clear the air. Is there a particular date that schools will be resuming? My second question will go to the PTF chairman. I would like you to comment on this. It has to do with Naira Marley. Some time ago, we know that he flouted the protocols. I'm asking this question because we know that when rules are made and sanctions are not applied, people just don't listen to such rules. We've made so many rules here, but a lot of persons have flouted these rules without consequences. What is the update on Naira Marley? And then my second question will go to the PTF National Coordinator. Yesterday, when you briefed the Nigeria Governors Forum, you announced that the federal government made a provision of 2.1 billion naira each as an intervention, additional health funding for each state. My question is, how many states are going to benefit from that provision? Will it include states that, in quotes, are COVID-free? And the second question from that is, do you have a particular okay, I thought he's not listening. Do you have a mechanism, a strategy on ground to monitor the use of that fund that the federal government is giving to the states, as you announced at the NGF yesterday? My other question, we go to the Director General of NCDC. It has to do with an event that happened at the Gwagwalada Treatment Center at the weekend. It's an unfortunate one anyway, because someone who is close to me actually developed symptoms, and he lives close to Gwagwalada, so he went straight there. And of course, expectedly, since there is no test that shows that he's a COVID patient, he was not admitted. And then 2 days later, he got tested. But before the result could come out, he developed very critical a symptom. He couldn't breathe and was referred. He went back to Gwagwalada, where they also said they can't admit him as a patient because the result is yet to come. So the question is this: what is the procedure actually for admitting someone in the treatment centers? And you partially talked about it, but why does it take this long for people to actually get their results? Because some are dying in the process of waiting for their results to come out. And then the Minister of Health, I would like you to comment on this, my last set of questions. The United Kingdom has a new policy now that allows healthcare workers to come into the country and get visa on arrival. This is actually driving a lot of medical workers from countries, especially in Africa, in Nigeria inclusive. What is the government doing in that regard to ensure that the little health workers that we have that are not even enough for us will not take advantage of that and all of them migrate to such countries? And secondly, is the government also doing anything regarding those vaccines that show early signs of potency that countries are already mopping up in their countries, like the United States and even the UK? They're already mopping up some of these vaccines. 3 of those vaccines that were announced last week, they have high potency results from their preliminary testing. Are we planning anything similar to that so that we'll not be left out at the end of the day? Thank you.
Good evening all. Rachael Abuja from the News Agency of Nigeria. My first question is for the Minister of Health. Sir, Nigerians will like to know how far we've gone with the renovation of 7 centers in the 18 or 20 local government hotspots for COVID-19 in the country. And more so, we'd like to know where this fund is coming from, because it's said to be 1.2 billion. We don't know if it's naira or dollars. So we'd like to know if there are donations or grants, or the state government or government will be paying for this. And also, where will these donations be taking place? States, which of the states? So we can have a follow-up. To the DG NCDC, sir. Sir, Lagos and Kano states are the 2 leading states in COVID-19 testing. And you just mentioned that Lagos has 7 centers to test, while Kano has 5. And let's not forget that Lagos test positivity is between 20 to 40%, while Kano is between 1 to 2%. Now, we all know that in terms of, let's say, both states differs in terms of climatic condition. Now, in addition, there has been suggestions by different countries and science groups on the role of, possible role of humidity and temperature in the rate of transmission for COVID-19. Now, I would like to know if we are planning to record the relevant data to enable studies on the possible correlation between COVID-19 and environmental condition. Thank you.
The Chairman, National Coordinator, members of the PTF, my colleagues. My name is Amaka. I report for Arise News. Well, from your opening statements, most of my questions were answered, but just remaining a few. And I'd like to start with the DG of the NCDC. Well, you spoke about ramping up our test capacity. What is our capacity at the moment? How many reagents do we have, and how far would that take us? And my next question also is for you. How many tests do we conduct averagely? Speaking daily now, because we're seeing this result come out every day, and we're seeing the numbers really go. Yes, we know we haven't peaked yet, but we need to know average, how many tests we conduct. And finally, to the Minister of Health. Well, sometime about 2 weeks ago, you had actually announced that hospitals in Abuja will become sample collection sites. How far with that announcement? I asked this because the Gariki Hospital, I had a reason to go there, and there was a suspected case of COVID, but they say they are not accredited to take any samples or even hold any patient there. And also, some time ago, you had spoken about hospitals creating a space, even though a person hasn't carried out a COVID-19 test, but at least a place where they can be managed instead of being turned back. Is that applicable to every hospital in the FCT and across the country, or is that for specific health facilities? We need that clarification so that way people know where to go just in case. Thank you.
Ẹ kú dédé àsìkò yìí o gbogbo ẹ̀yin ọmọ orílẹ̀-èdè Nàìjíríà jákèjádò gbogbo àgbáyé. Ní ìrọ̀lẹ́ yìí, màá fẹ́ mínísítà wá fún ètò ìlera ní ti abẹ́lé, Sẹ́nitọ̀ Adeleke Mamora, kàn bá wa dáhùn àwọn ìbéèrè èyí tí mo fẹ́ béèrè lọ́wọ́ wọn ní ìrọ̀lẹ́ yìí. Àkọ́kọ́, mo fẹ́ bẹ̀rẹ̀ láti ibi tí iléeṣẹ́ amóhùnmáwòrán ti channels tó ti kọ́kọ́ bẹ̀rẹ̀ nípa ìtọ́jú àwọn tí wọ́n ní àrùn yìí nílé ìwòsàn. Ó ṣe ní láàánú wípé ọmọ kékeré kan ní ìjàmbá mọ́tò, wọ́n sì gbé lọ sílé ìwòsàn. Ṣùgbọ́n nítorí pé àrùn COVID-19 tó wà níta, àwọn onítọ́jú wọn ò tọ́jú ẹ̀, ó dẹ̀ gbabẹ̀, ó di olóògbé. Ǹjẹ́ a lè sọ wípé eléyìí bójúmu àbí ó kù díẹ̀ káàtó? Ìlú Abuja níbí báyìí ni eléyìí ti ṣẹlẹ̀. Èkejì ni wípé ẹ̀ẹ̀mélòó ló yẹ kí èèyàn ṣe àyẹ̀wò àrùn COVID-19 láti mọ̀ bóyá lótìtọ́ àti lódodo lẹ́yìn ní àrùn COVID-19, nítorí pé ó ṣeé ṣe kéèyàn kọ́kọ́ ṣe àyẹ̀wò lákọ̀ọ́kọ́ kó rí pé òun yege, kó wá padà lọ délé bóyá ọjọ́ kejì àbí ọjọ́ kẹta kí àrùn COVID-19 bẹ̀rẹ̀, báwo ló ṣe fẹ́ ṣe? Ǹjẹ́ ó ní láti padà lọ ṣe àyẹ̀wò ni àbí kí ni ìgbésẹ̀ tó yẹ kó ṣe? Èkẹta, nípa ti ètò ẹ̀kọ́, ìpínlẹ̀ Ọ̀yọ́ a rí wípé wọ́n sọ pé wọ́n fẹ́ jẹ́ kí àwọn ọmọ iléèwé kó padà sí iléèwé, ṣùgbọ́n táàmù kẹta tí a mọ̀ sí third term kò sí nǹkan tó jọ bẹ́ẹ̀ ní ìpínlẹ̀ Ọ̀yọ́. Kí lẹ lè sọ nípa eléyìí fún àti jẹ́ kí àwọn òbí kí ó lè yé wọn ní yékéyéké? Bákan náà ní ìpínlẹ̀ Ògùn, okay, I will say it in English so that you can understand, sir. So so in Ogun State, sir, ní ìpínlẹ̀ Ògùn, my minister, sir, ní ìpínlẹ̀ Ògùn, ìṣẹ̀lẹ̀ kan ṣẹlẹ̀ níbẹ̀ débi wípé arákùnrin yìí wọ́n ní pé kò tẹ̀lé òfin èyí tí wọ́n fún wọn lórí àrùn COVID-19, ṣùgbọ́n nígbà tó débi tó ti fẹ́ jẹ níyà wọ́n ní kó mú owó wá, owó tó rí kò pé, ó padà wọ́n gba mọ́tò ẹ̀ sílẹ̀. Nígbà tó máa padà dé wọ́n ní pé àwọn ò lè gba owó yẹn. Ó ṣe ní láàánú wípé lójú wọn ń bẹ̀ yẹn ni arákùnrin ti gbóògùn jẹ tó dẹ̀ gbàbẹ̀ kú. Ṣafẹ́ sọ pé lára àwọn tí àrùn COVID-19 pa ni eléyìí ni àbí àìsàn owó ló jẹ́ kí àrùn yìí pa? Eléyìí tó wá gbẹ̀yìn ni pé mo fẹ́ rọ iléeṣẹ́ elétò ìlera lórílẹ̀‐èdè Nàìjíríà. Àwọn onímọ̀ ìjìnlẹ̀ pọ̀ lórílẹ̀‐èdè yìí tí wọ́n jẹ́ ọ̀dọ́, àwọn míì gan tẹ̀ ti sá lọ. Ṣé bí àwọn dókítà lásán pé wọ́n fẹ́ sá lọ sí ìlú òyìnbó? Àwọn onímọ̀ ìjìnlẹ̀ gan lọ nítorí pé kí ni ó dàbí pé wọ́n káràmásìkí wọn ní ilẹ̀ òkèrè ju orílẹ̀‐èdè Nàìjíríà lọ. Mo fẹ́ kí iléeṣẹ́ elétò ìlera kó wo àwọn bíi NCC, Nigeria Communication Commission, àwọn NITDA àti Federal Ministry of Science and Technology láti lè rọ àwọn ọ̀dọ́ yìí láti padà wá láti lè ṣiṣẹ́ èyí tó dára kán bá lè ràn wá lọ́wọ́ lórílẹ̀‐èdè Nàìjíríà. Ẹ má jẹ́ ká sọ àwọn èèyàn tí a ní orílẹ̀‐èdè inú. For the Federal Minister of Education, sir, so that you understand it in English, what I asked my minister is about education, sir. In Oyo State now, the government said the pupils can resume in September. There is nothing like third time. What can you say about this? Thank you very much, sir.
Good evening. Good evening, the chairman and members of the PTF. My name is Mitaire Ikben. I report for the NTA. I have just one question for the DG of the NCDC. It's good to know that we now have about 59 molecular laboratories nationwide, but there's still a problem of getting across to the NCDC. Abuja is a peculiar case. People call and they say they cannot reach the NCDC. In fact, it is almost becoming a case of if you are not connected, you cannot reach the NCDC. If you don't know somebody who knows somebody who knows somebody that can get across to the NCDC, then you can't reach the NCDC. And it's as bad as for some of us here as journalists, we have some complaints have come to us and we have forwarded them to the appropriate quarters, and it still gets up to 3 days before persons are attended to. I know that these complaints are not new to you as the DG, and that's why we want to know what you are doing to bridge the gap in getting across to the NCDC. Thank you.
Thank you. We've taken all the questions and we'll be receiving responses from the Honorable Minister of Health, the DG NCDC, the National Coordinator, the Honorable Minister of State Education, and the Honorable Minister of State Health. The Chairman, PTF, will round it up after all the responses. We'll begin with the Honorable Minister of Health.
So thank you for the questions. The first one is about patients being rejected in the treatment centers in hospitals. That is regrettable. It is not what should be happening anymore. Yeah, it is true. I had a meeting with the Honourable Minister of the FCT a couple of weeks ago, in which we dwelt on this topic and called all medical directors and chief medical directors of both federal and FCT-owned hospitals to impress upon them that nobody should be rejected. We are going to repeat that with private hospitals. We are preparing the grounds for that, to call private hospitals and also speak to them on the same topic. The policy of the government is that all persons who come to hospital should be given attention, no matter how basic, and to call for help. But of course, we are still working on improving our programs, and part of that is the communication we give here every day, that people who are tested positive should not disappear. You should register yourself. We say that every day here. And today I also pay tribute to influential persons who declare, yes, I tested, I was positive, I'm going to treatment. It's a good example. So we believe that if more people were doing that, then the number of surprises of people fall suddenly ill at night and they are looking from one place to the other, the number will be less if people would actually comply with that. And I express my deep regrets to the family of the person you mentioned. I think we said that communication. I deeply regret my condolence to the person and to the family. It's a deep loss. That's the kind of thing we are trying to avoid, that we lose anybody to COVID-19. We're always talking about reducing fatalities. And we can only do that with cooperation of all citizens. And part of it is that anyone who tests positive should present themselves for treatment. If they have comorbidities especially, they should in fact go on admission so as they are supervised all through the time. The other strategy we have is that we have instructed every hospital to also be ready to test, ability to test. That one is still ongoing. I think there are about 7 of them now that are already prepared to do testing, to take samples. The DG of NCDC will speak more about that because they set up this system that you can collect samples at certain hospitals, various hospitals. It's not a big deal, but they're prepared, who are equipped, trained, and ready to be able to collect samples and have them collected. That is in progress. And then we're also setting up, which is already functioning, an ambulance system that you can make a call and then the ambulance will pick you up and take you to where you'll be treated, so that you are not the one running from one place to the other looking for a place of treatment. So that is already in the work here. We did one, we set it up in Kano and it's worked very well there. And we're setting up here in Abuja. I was given a report this morning that they're already operating skeletally and they'll be scaled up. So that if you call a number, you have symptoms, you're in dire distress, you can call and you'll be taken to where you definitely be treated. Because not everybody knows the best place to go to. If you go to a hospital next door, which is not ready for you, they will tell you they won't be able to treat you. But we also urge even such hospitals to at least give oxygen and then call for the ambulance. All clinics should know the ambulance number by now. So we request that all citizens be ready to comply with these guidelines that we have given. If you have comorbidities, please report. And if you feel that you are getting bad, funny symptoms, which I listed just now, I listed them during my speech today. If you have any of those symptoms, you have to go early enough to an accredited hospital for testing. Don't wait and say, okay, till tomorrow you will go, because COVID does not know day or night. So if you get symptoms at 6 p.m., you say, okay, tomorrow you will go, it may be too late. It doesn't know, it won't wait for you. Nothing is going to wait. So you have to act fast and avoid situations where things now become an emergency, which would also not have been. So please, everybody report in time and we shall reduce, that's our objective, to reduce the casualties. Now, with the question of vaccines, yes, we are observing the development of the vaccine. There are several vaccine candidates being tested in various countries right now. Everybody is scrambling to get the vaccines. The High Commissioner of India spoke in that respect when he visited us some time ago, just a couple of days ago, to say that India is also working on developing a vaccine. I've heard the president of China make the same statement. In America, they obviously do a lot of tests, and the UK and other countries in Europe, everybody is scrambling for vaccine. Now, His Excellency the President has started an initiative by which the African bloc of countries should work towards getting access to vaccines. That initiative is ongoing to be able to make sure that Africans are not shortchanged when vaccines do come out. And it's our prayer that these vaccines come out in large areas, in large numbers and in multiple sites. With regard to the hotspots and the 2.1, I will leave that to the national coordinator. He is the one looking at the hotspots in the country, the very local governments that are particularly suffering from the widespread infection of COVID-19, and also the question of allocation of funds from those sources. Now, we have spoken about the sample collection sites. Our objective is to make sure that all hospitals are able to take samples. Taking samples is not a big deal. All you need is a good logistics to collect all of them. Most of the PCR machines have capacity to test large numbers at once. They can test several, do large numbers. So if you collect all the samples, you can do one test, you can get many results coming up. They are, as we know now, they are being used at less than 40% capacity. So the logistics is what has to be done properly and with some more experience. The management of cases, it's not every hospital. There are specialized hospitals that are doing COVID-19. Isolation hospitals, we are told, we've named them here before. Many times, those are the only ones taking care of COVID-19. But any other hospital that intends or desires to participate in treating COVID-19 patients can request for accreditation. A team will come and accredit the hospital, and specialists can help to demarcate the areas, the so-called clean and dirty areas for you, and give you necessary training and make sure you have the necessary staff. So that is possible, but if you are not accredited, this is not something that anybody should be treating anyhow. Okay, with regard to the doctors, well, you see, this period is a very uncertain period where all countries are looking for doctors from everywhere and trying to make sure that you don't only think of buying equipment, buying commodities, buying that, you also want to increase your manpower, and they are ready to take manpower from everywhere. So we are trying to see that we keep our own manpower here. As you know, there are incentives that have been given, like life insurance and hazard allowance and so on. All those ones have been provided. And we hope to continue to chatting with our resident doctors and urging our state governments to actually employ the doctors who are unemployed and make sure that the availability of manpower for health is not compromised. So I think that that will be the subject of conversation when we speak with the NMA and the Association of Resident Doctors. So I think that is all we have here. The number of hospitals that can take samples will continue to increase. We hope that we can be able to help many hospitals to at least take care of emergencies that come in and then call for help, that you have an ambulance system that will come and pick up the patient from where they first arrived and take them to a designated treatment center. So when that system starts working, we see the value of a medical emergency system. As you know, we are working on what we call a national emergency medical system and medical service and ambulance system. National Emergency Medical Service and Ambulance System, NEMSAS, which is under development to be able to provide services of all kinds of emergencies, including obstetric. Those who can't, who have delivery issues and so on, you can call a number and the ambulance will come to pick you up. Paramedics will be on board. That system is under development. We have a consultant helping us with developing that system. Thank you.
So thank you, gentlemen of the press. I think we'll start with Friday. Friday, thank you very much. It's really unfortunate the experience your colleague had. And I think the Honorable Minister has already addressed the issue of waiting and rejecting patients. You know, no hospital should be doing this. Most hospitals have set up holding areas where when there's uncertainty about a diagnosis and the individual is showing symptoms, every hospital should have a holding area. We've been supporting hospitals. We have an IPC team that has been supporting all the tertiary hospitals in Nigeria to set up triage centers. A triage center is when you come in, you test. When you come in, you're screened. If your symptoms are similar to what could be COVID, you're put in a holding area until we can determine the diagnosis. But, you know, the tools that we have to force hospitals to do these things, you know, we live in the country we live in. So we keep pushing, we train, we support, and we hope that eventually we'll get better. You know, maybe whatever hospital is watching this, there's no way around this. We have to live with this situation for the next 1 year, at the very best. So we can't turn our patients away. The technology that we have for testing, even if it works optimally, cannot provide us a test as quickly as we need to. So we absolutely need to set up a system where we can put patients in a ward or in a holding area where they can be seen and cared for safely. The IPC measures with which we can manage our patients safely until we can determine whether they have COVID-19 or not. So we'll continue to work through different points in making this testing quicker. We've worked extremely hard in developing this platform. It will go live soon, but it will not solve all the problems. So we really need every healthcare worker in the country to help us engage with this problem. And maybe together we can find a way around it. Rachael, you asked about the difference in positivity in Lagos and Kano. You're right. What determines that is very difficult to ascertain. It depends a lot on the pressure of the initial infections, the pressure of transmission thereafter, and several other factors. If humidity or temperature plays a role, it's definitely something we're looking. In fact, this morning there was a meeting of the National COVID Research Consortium. A whole consortium of partners is co-led by NCDC and the National Nigerian Institute for Medical Research, includes TEDFund, the Manufacturers Association of Nigeria, several universities across the country. They have come back together to form a strong consortium to do this type of research, because this is not the type of research that one person can do in his small office. You really have to pull your forces together. So there's an amazing evolution of expertise growing, and I've said here severally, if this outbreak reignites a passion for science, we would have really pushed this country forward. It is doing that for health security. It will do that for science in different ways as well. Amaka, you asked a few questions about testing our current capacity. So far, we've tested 250,000 people. We have the capacity at the moment to test about the same amount with reagents in the country already. So we can do double that number right now. Of course, you know, there are many limitations in here and there, but that's where we are. At the moment, we're testing 3,000 to 4,000 tests every day in the different labs in the network. So on a good day, about 4,000, you know, it's anywhere between 3,000 and 4,000. So pushing very hard to keep increasing those numbers and increase the efficiency of testing. Mitara, you asked about ability to reach NCDC. I think, that has improved a lot. The challenge is that people really don't know the difference between reaching NCDC can't evacuate patients. That's an FCT responsibility in Abuja. So if you get through to NCDC, what we do is refer you back to the FCT lines. And sometimes there's a delay in doing that. So we keep working with them to improve that patient evacuation process. But mostly it's not the NCDC lines actually that is the challenge now, because an NCDC cannot activate the next steps. What we often do is give you clinical advice, check your symptoms, see whether you require evacuation. If you do, then refer you on to the relevant state. We're a national helpline, so we support all the states, but we're a high-level communicator. The next level is to provide you the access to the state lines, and it's only the state. If you're an FCT, yes, it's the FCT, but any other state to then organize your evacuation into care. But having said that, like the Honorable Minister said, we have now supported the FCT in activating walk-in centers to get tested. There's one in the ICC that is functional. FMC Jabi is functional. Maitama District Hospital is functional. The This Day Dome, the testing center there, is functional as a walk-in center. So these 4 centers, yes, you can walk in there and get tested, and your result will be made available to you. The delay sometimes, like I said, is not in the testing, it's in the resulting process, and this online platform will help us solve that. So, we're being very open with our problems and our challenges and the work that we're doing to solve all of them, and we will get better at all of this. So please bear with us wherever things have been a bit slow, but everybody's hands on deck to make results available quicker to everyone that needs those results in order for you to come into care and in order for the contact tracing and the rest of the public health response to continue. Thank you.
I think there were some questions regarding, one was the issue of Jabi Lake Mall, and just to make it clear, the PTF certainly has repeatedly said that we will not sit down and just watch while people clearly flout the rules that have been put in place for the good of the public. We have formally requested for investigation of the Jabi Lake Mall, and at the highest level, we've also requested for legal processes to come in place. I believe that's still being investigated. I have requested for an update from the relevant authorities, and once we have an update, we'll let you know. With regards to additional interventions from the Nigeria Governors Forum, my understanding is that the Nigeria Governors Forum meeting is supposed to be a closed meeting, so I'm surprised you were able to get details of that meeting. But nevertheless, there are several funding streams that are coming to the states. Some of those funding streams are currently under negotiation, including a World Bank credit facility. Some of those funding streams there's already money that is going to some of the states. In fact, some of the states have already received a small amount to start off with. There are additional funds that are coming directly from the federal government based on the National Assembly budget that has just been passed. That money has not been released yet, but is certainly in the budget, 2020 revised budget for the states. We have developed a template working with the state governments and the Nigeria Governors Forum that outlines the key parameters that will be used to allow states to access these funds. And we are working very closely with all the states. Some of the states have already fulfilled some of these requirements. For those that haven't fulfilled it, we are working very closely with them to make sure that they fulfill the requirements in line with the national COVID response. And as soon as they do so, we will sign them off. From the point of view of hotspots, yes, there are 11 local government areas at the moment based on a combination of criteria that we have outlined. Those criteria include the number of cases. They also include the proportion of positive cases by each local government, and also the rate of rise of new infections. Based on all 3 parameters, we identified 11 local governments in 4 states, Lagos, Ogun, Rivers, and Bayelsa State. we've already started making a lot of progress, particularly in Lagos, where some of the interventions that we have put in place in relation to risk communication, for instance, in relation to additional testing, and as well as household surveillance, etc., has come into place. But your specific question regarding community support centers, so we have a proposal which is currently based on the National Primary Healthcare Development Agency, where we will be identifying buildings that can be converted into community support centers in relation to these 11 local government areas. That funding has not been secured yet. We have applied for the funding through the UN single basket, and it is not $1 billion. No, it's certainly not. It's far from that. It's in Naira. And as soon as that funding is made available, we will commence the process of funding the community support centers. And it's completely different to the plan within the COVID budget to build an isolation and treatment facility in every state linked to a federal medical center or a federal teaching hospital. That budget is a federal government budget that has not been released. It is part of the Federal Ministry of Health Infrastructure budget. So it is linked to the new budget that the National Assembly has passed. And as far as I know, no money has been released for that purpose yet. Thank you.
Honorable Minister of State Education.
Good evening. Jẹ́ kí n sọ fún ẹ pé gbogbo wọn àwọn Ọ̀yọ́ State wọ́n ní. Okay, sorry. I thought they said I should answer in Europe. Good evening. Let's start again. Good evening. For your state, this speaks to what we are doing here. We believe that this is our response is a national response. We believe that all the states should actually be working together. The PTF provides national guidance, and we expect that states will then use what information that they have gotten there from to interpret them locally. I repeat again that that education is a concurrent matter on our legislative list, and states are free actually to make those kind of provisions within the guidance that the PTF has provided. And that is why the guidance we gave, somebody may see it as that there has been a change or some sort of misunderstanding. And I have spoken repeatedly that if you look at what the chairman of the PTF presented in June, he said he's not giving a date for school resumption. That what he has proposed and what the PTF has proposed is that in view of WAEC's timetable, it will be advisable for those who can to try and make arrangements to use the facilities that are available. That is exactly what is in the guidance we gave. That guideline suggests to schools that you should please evaluate what you have done, like a template. We gave a template there. Tick, checklist of what we have said is the requirement you need to put in place to be able to use these facilities. And we've given a cutoff date for 29th of July to expect all the responses from the centers so that we can then know who needs help. If your problem is that you have already gotten the bucket and a tap, but you don't know how to insert the tap to the bucket so that it starts turning it into running water, then we need to know. Such a simple step may be important. We need to know if the problem is that the teachers in at your own location cannot be provided with masks. If the school is unable to do that, we need to know ahead, because states that have given dates for the resumption of schools are doing that and setting out a timetable along the lines of what we have already explained. And they are free to do this. What we then must answer is the WAEC timetable. Are you able to meet up with that date? Many states have come back to us and said they are unable to meet up with that date, which is why the Minister of Education explained that it will be dangerous to move children out on that date, and that it is not proper for WAEC to then continue to insist on those dates. Therefore, we have requested that WAEC give us and the schools some time to meet up. Now, WAEC, unfortunately, is unable to wholesomely move the exams. But we have also worked out a negotiated timeline with WAEC such that what we call peculiar Nigerian subjects, which in the language of WAEC are subjects that are only held in Nigeria. That's Igbo language, Hausa language, Yoruba language. These are language exams. These are some what we call peculiar. They are peculiar only to Nigeria. The Ghanaians will take what we call the Fante. They have their own language. Those are peculiar to them. Those exams will not happen in Nigeria, but they're all in the first part of the timetable. So we will now work out a domestication module that will take our peculiar subjects behind after we have done generals. This will buy us the time we need for all of us to be able to come to be at par with the rest of West Africa and operating at the same time. Because the unanimity with which WAEC has always worked is still very important to us. Nigeria is not moving away from it. The option would have been to go to November to take the GCE external exams. Nigeria is carefully studying that if in the event that everything fails, we may go to that. But we are working assiduously to keep within this time frame so that everybody will work within this. But the key factor of safety, we will not open these schools until we see and are sure that children can go in there with as maximum safety as possible. We can't be 100% sure, but then we've given out those templates. And the same faith we have in Nigerians are the faith, because when my sister asked her, she said, how do we trust that the people will build the template, how do we monitor them? The same way we feel about Nigerians, we believe at the same way their teachers and their owners and proprietors will feel about their children. We know that these children, yes, they are our children nationally, but sometimes the idea to give guidance is to ensure that they do the right thing. We do not believe that they will be callous with the lives of their children. In fact, if anything, we expect them to tell us what their problems are so that we can then assist where necessary, because we've made a request to the PTF looking at what it is that people may need or what may be the problems, and to find solutions around them. Solutions are not just give you money. Solutions may be giving you what is available within the context of what your problem is. And that we are working on with them. And we are engaging stakeholders again. Post 29th, we will meet with stakeholders on the 30th in readiness for opening via Zoom, because as you've heard, after that there will be public holiday. So we want to be able to cap this around with all the commissioners of education around the state, all the chairmen of SUBEB, the Association of Private School Owners, and the Nigerian Union of Teachers. So there is no controversy. The Ministry of Education has at no time, I don't know why anybody would think that there is some sort of bifurcation in what we have said. None at all. We've been consistent with the message from the time the PTF chairman announced it, to say there is some guidance that needs to be done along the paths of how we will open schools. And that guidance is still what we're staying with. Any assistance we want in those clear, or whatever any state has then declared, are things that are working in consonance with that. Thank you.
Thank you very much, Mr. Chairman, my colleagues, and media representatives here present, ladies and gentlemen. Let me start by thanking Amaka for responding to part of the queries. Mo dúpẹ́ lọ́wọ́ arábìnrin Abiodun Pokuola láti ilé-iṣẹ́ Voice of Nigeria. Mo dẹ̀ dúpẹ́ lọ́wọ́ ẹlẹ́gbẹ́ mi tí ó jẹ́ mínísítà abẹ́lé fún ètò ẹ̀kọ́ tí ó ti ṣe àlàyé nípa ìkan nínú ìbéèrè yẹn. Ètò jẹmọ́ wípé àgbékalẹ̀ PTF tí ààrẹ orílẹ̀-èdè wa ṣe, tí ó ń ṣe ètò ní àpapọ̀ fún bí a ṣe ń dá sí ọ̀rọ̀ COVID-19. But bó ṣe wà ní àpapọ̀ yẹn, àwọn ìpínlẹ̀ kọ̀ọ̀kan wọ́n sì ní agbára láti ṣe àwọn nǹkan tí ó tọ̀nà. Nítorí pé ètò ti PTF ní àpapọ̀ ó wà fún láti máa tọ́ àwọn ìpínlẹ̀ sọ́nà bẹ́sẹ̀ẹsẹ̀. Ṣùgbọ́n ó ṣeé ṣe kó jẹ́ wípé ní ìpínlẹ̀ kọ̀ọ̀kan àwọn nǹkan kan wà tó jẹ́ pé ó wà peculiar sí wọn. So same national response ni. Now, to other questions. Ìbéèrè kìíní ni wípé ọmọdékùnrin kan wà tó jẹ́ wípé ó ní ìjàmbá ọkọ̀ tí wọ́n gbé lọ sí ilé ìwòsàn. Ṣùgbọ́n ìdí pé wọ́n mọ̀ bóyá ó ní COVID-19 àbí kò ní, ìdí yẹn ni wọ́n wà tí ọmọ yẹn tí ó fi láti gbàbẹ̀ lọ. Irú nǹkan báyìí, nǹkan tí ó mú ìbànújẹ́ wá fún dókítà, ẹnikẹ́ni tó bá jẹ́ dókítà àbí ẹni tó ń ṣe ìtọ́jú fún aláìsàn, tí aláìsàn yẹn tó bá kú, kò ń ṣe nǹkan tí ó máa dùn mọ́ dókítà nínú. So mo ń fi àsìkò yìí gbà á ládùúrà yìí pé ìdílé tí irú nǹkan báyìí ti ṣẹlẹ̀, kí Ọlọ́run kí ó tù wọ́n nínú. Kò ń ṣe nǹkan tí a fẹ́ rárá kó ṣẹlẹ̀. Mo dẹ̀ mọ̀ yìí pé nínú nǹkan tí mínísítà àgbà ní tí ètò ìlera ti sọ síwájú, kì í ṣe nǹkan tí a fẹ́ rárá. Ìdí èyí ni a ti ń gbé ìgbésẹ̀ láti rí i pé a ní nǹkan tá a lè fi máa ṣe àyẹ̀wò tí mo lè pè ní àyẹ̀wò ní pápápá tí à ń pè ní rapid diagnostic test. Mo ti ń sọ ọ̀rọ̀ yẹn tipẹ́. Nǹkan tó jẹ́ dandan kí a máa ṣe ni pàápàá jùlọ ní àwọn ibi tí à ń pè ní accident and emergency centers ní gbogbo àwọn ilé ìwòsàn wa. Nítorí pé a fẹ́ akọ̀ nígbà tí wọ́n bá gbé aláìsàn wá, ó di dandan kó jẹ́ pé dókítà tó máa tọ́jú aláìsàn yẹn á fẹ́ mọ̀ wípé ṣé kò ní àrùn COVID-19. Ní irú ìgbà bẹ́yẹn, ó di dandan kó jẹ́ pé àyẹ̀wò tá lè fi mọ̀ pé ó ní COVID láàárín ìṣẹ́jú 10 sí 15 ni a láti máa a lè dúró de àyẹ̀wò kan tó máa lọ sí ibùn wákàtí kan ká má wà ní ọjọ́ kan ọjọ́ méjì. Bí screening test ni. Mo dẹ̀ mọ̀ pé PTF àti Ministry of Health.
All right, guys, at this point, I want to end this broadcast at this moment. We sincerely want to thank you very much for your time and apologize also for the error earlier. My name is Twitria, I still remember this is, we're still doing this from home. That was the voice of my wife. So thank you very much, guys. We'll see you. We'll be back with our regular programs very soon. Thank you very much for staying tuned. And of course, we'll link up with Shanes TV for this. So many thanks to Shanes TV for being the number one. Yeah, thank you, guys.
Nǹkan tí a mọ̀ ni pé tí èèyàn bá ní exposure sí bóyá ẹni tó ní COVID-19, kí tí ẹnìyẹn gan bá máa ní àrùn yẹn, nǹkan kan wà tá à ń pè ní incubation period. Ìyẹn ni ìgbà tí èèyàn ní exposure sẹ́ni tó ní, tóun náà bá máa ní. Nígbà wo ni àwọn tá à ń pè ní nǹkan tá à ń pè ní symptoms, àpẹẹrẹ pé kíní ti wọ ara ẹlòmíì, ó máa ń tó bí ọjọ́ 5 sí bí ọjọ́ 12. Ṣùgbọ́n bí ọjọ́ 5